Hello everyone, welcome to our SME station today. In this station, we are going to present on the evaluation analysis of the treatment planning information for 3D radiotherapy planning of transglottic cancer. For your information, the objective of radiotherapy treatment planning is to obtain an optimal balance between delivering a high dose to target volume and a low dose to intervening tissue. According to the International Commission on Radiotherapy Units and Measurement (ICRU) Report 50 and 62, when delivering a radiotherapy treatment, the volume of the dose must be specified for several purposes, which include prescribing, recording, and also reporting. This diagram shows different volume as defined in ICRU Report 50 and 62. In ICRU Report 50, only three volume concepts were defined, which are GTV, gross tumor volume, CTV, clinical target volume, and also PTV, planning target volume. Later, internal target volume was introduced by ICRU Report 62. Gross tumor volume or GTV refers to the gross palpable or visible tumor, or with the help of imaging such as CT, MRI, and PET. In this case, the GTV is the site of the primary tumor. CTV is defined as a tissue volume that contains a GTV and or subclinical microscopic malignant disease which has to be eliminated. As referred to this case, CTV is the glottic layering with a border at least 10 mm superiorly and inferiorly from GTV. Axially, the bilateral mucosal laryngeal surface is included as field change is very common. This volume has to be treated adequately in order to achieve the aim of the therapy, either cure or palliation. According to ICRU 50, if the aim of therapy is for palliation, the therapy is done just to reduce the symptom and it may include all or only part of the tumor. In this case, palliative treatment may reduce pain and reduce dysphagia caused by tumor or tumor ulceration in the neck. Also, common problem may occur include airway compromise from endolaryngeal, stomal or pharyngeal recurrence, which can be somatic or neuropathic pain from soft tissue, peripheral nerve invasion, fistula and necrotic wounds in the neck, and also deglutition problem that add to nutritional deficit. Internal target volume, which defined by ICRU 62, is the internal IM margin given around the CTV to compensate for variation in the site, size and shape of organ and tissue contained in or adjacent to CTV. PTV refers to ITV plus the setup margin, which might include uncertainty patient positioning, mechanical uncertainty of equipment, dosimetry uncertainty, and transfer setup error and human error. However, separate delineation of the ITV is not necessary, but motion should be included in the PTV. In this case, PTV is CTV with a 3 to 5 mm isotropic margin depending on local assessment of random and systematic error, assuming tumor movement is minimal. Motion can be assessed by watching laryngeal movement with fluoroscopy in the simulator to ensure that the vocal cord remain within the PTV on swallowing.
We will go through the treatment plan for this case. Total dose is 4005 centigrade in 15 fraction, and because this is for palliative case, 267 centigrade per fraction is acceptable. There are three fields in this plan, which are left lateral neck G90, right lateral neck G270, and anterior neck G353. The energy used is 6 MB photon. The radiotherapy technique chosen is 3D CRT because the patient is doing the palliative intent. To compare with other techniques like IMRT and VMAT, 3D CRT is quite difficult to spare organ at risk. SAD technique will make the machine setup reproducibility easy for multiple fields, then minimizing the impact of setup inaccuracy. Moving on to the dose planning. As you can see, there are two regions with red color at anterior side and left side. This region have exceeded the maximum dose recommended by ICRU 50. According to the ICRU Report 50, the uniformity of dose distribution is described in terms of the maximum and minimum dose within the planning target volume PTV. The maximum dose in the PTV should not exceed 107% of the dose, and the minimum should not be smaller than 95% of the dose. Beam modification device used in this plan is bolus and wedge filter. The function of the bolus is to alter the maximum depth dose Tmax and act like additional skin. In this case, 0.5 cm bolus is put on the entire neck. For both right and left lateral neck field, wedge filter is used to tilt the isodose curve from their normal position.
Okay, now I will explain about the alternatives. So the first one will be the spinal cord, where the dose for the whole organ tissue tolerance will be 47 Gray. Range of maximum of the dose will be 45 to 50 Gray. 10% as the volume of 45. The contact report stated that the reported risk of myelopathy is low, which is less than 1% when the maximum spinal cord dose is limited to 13 Gray in a single fraction or 20 Gray in 3 fractions, which estimated risk level for those limits are 0.9% and 0.7% respectively. Moving on with the next organoids will be the esophagus, where the side effect of the esophagus will be esophagitis, where the mean dose will be less than 30 Gray. For the volume of 35, it will be less than 50%. For volume 50, it will be less than 40%. And for the volume of 70, it will be less than 20%. So this is the image of the esophagus. Moving on with the other extremes will be parotid gland. For the bilateral whole parotid gland, the long-term parotid salivary function reduced to less than 25% of pre-RP levels, where the mean dose will be less than 45 Gray. The mean dose will be less than 25 to 26 Gray. For the volume of 15, it will be less than 67%. For volume 30, it will be less than 45%. And for the volume 45, it will be less than 24%.
Next is about the side effect patient may get and how to manage it. First side effect is skin redness and discoloration of skin. So patient need to avoid to stay directly under sun, avoid wearing tight clothes, make sure the area of treatment always dry, do not scratch the skin and can apply aqueous cream. Next is dysphonia or hoarseness. Patient need to maintain adequate hydration and can do voice therapy that are designed to reduce inflammation with semi-acute vocal tract phonation and maintain or improve flexibility with light exercise. Dysphagia or difficult in swallowing. Patient need to avoid eat spicy food, dry food, and hot drink. If patient difficult to eat, they can drink milk such as soy milk. If patient have very painful sore throat, we suggest to use percutaneous endoscopic gastrostomy tube or nasogastric tube. Xerostomia is occur because of radiation near the salivary glands. So, a meticulous oral hygiene regimen is recommended, including twice daily toothbrushing, regular use of floss or another interdental cleaner, and use of alcohol-free mouth rinse. They also need to maintain adequate hydration by frequently sipping water, sucking on ice, or using a humidifier during sleep. Last is lymphoedema. Patients need to reduce the risk of injury and infection at the neck. All cuts should be washed, treated with an antibiotic ointment, and monitored for infection. Do not wear clothing or jewelry that is constrictive around the neck.